reports, especially after accidents, which most of these have been about. And just that patient communication and making sure you don't set a person up to change the outcome by how you describe or how you discuss things with them after an accident or after you see imaging. This could apply in a lot of ways, but we had two guys in the same accident. They worked together. They do like flooring kind of stuff. One's 21, one's 35. And I just wanted to, go through how things can look on imaging, mostly just given people's age. So we have the x-rays done post-auto accident, we always do. And most of the time, we're not going to see anything that's going to change course of action. And that's the big thing to reiterate to the patient when you're discussing what you might see on a report. So the main things we're looking for is gross fracture, joint dislocation, compression fractures, things like that. Something that's could be need immediate attention. And even if it's not, and every now and then you do find a fracture on someone who's in your office post-accident, didn't go to the hospital afterwards. They're really sore, but depending on how things break and so on. But so the main thing is getting these reports back just to make sure that they understand. We don't have any gross problems, no big issues that need immediate attention outside here, and we're still on the course of action that makes the most sense, and they're going to continue to improve. And so a lot of the times these people don't get these done for a week or two afterwards, and many of them feel quite a bit better by that point that we get these back. So you always have to keep that in mind when you're discussing it with the patient, because there are, unfortunately, like how you present what you're seeing or what you do or don't present while you're going through the report can make a difference in how the patient, feels moving forward. So if you say the first person, the younger one, that's 21, no fractures, no dislocations, and if you also read through no significant degenerative changes, and that's a terrible word, unfortunately, that gets used a lot in radiology, but it's just a descriptive word. Does the joint and disc spaces and the joints look different than we would normally expect? And so you have to, unfortunately, that word gets used a lot. And when a patient hears that word, they start to get scared of, well, what do you mean degenerative changes? And so if so the younger guy, we don't have to say much. We're like, hey, nothing significant on imaging findings that is going to change what we're doing or we're currently doing. And he's already feeling tons better. So we're just going to move on from there. Hello. Then the other one, who's 35, no fractures, no dislocations, all good. The one thing that it does mention is there is some mild disc space narrowing, some mild degenerative changes. So when we were thinking about this, 35, that's the kind of stuff we're going to start to expect to see regardless of if the person was in an accident, because those are things that were not caused by why they're here. And the patient reports no symptoms in these areas prior to the accident. So we know that these are not things that are driving a negative outcome. They're just things you would normally see on somebody who works for a living who's in their mid to late 30s. So we just have to make sure that for him, when we're discussing this stuff, we kind of say stuff similar to the first person, where we're not seeing anything. Radiology reports are back. We're not seeing anything of significance that is going to change our course of action or alter our treatment plan. You're already continuing to improve, and you're almost back to doing all your normal activities, and your pain is significantly reduced. So we're just going to continue with our current course of action, and you should continue to get better and be done. You're kind of at the next reexamination. So, a lot of ways, I probably am not a gloss over or not even going to discuss the things that we would have expected to see anyway, because they're not going to change how we are working with the patient currently. So, just keep that in mind. Even if you are working with a patient who's just coming to your office, not related to an accident, and you're taking imaging, just make sure that you're how you're describing things to the person leaves them feeling like their outcome is favorable and they're going to get better, and don't cause a lot of confusion and leave the person feeling real negative about their situation, when many times a lot of the stuff you're seeing is not really driving the symptoms, and more than likely is just there just because of how old they are. So hopefully that helps some people out when they're working with patients in clinic. Check my YouTube for other great material, and see you next time.